Dear Chairman, Professor Koch, dear ladies and gentlemen, and dear colleagues connected online, thank you for being with us. It's a bit late, and we have a very interesting topic to discuss and present regarding new products that can actually prevent and manage kidney stone disease. It's very important for us that we are surgeons to be able to give appropriate advice to our patients so that they won't have stone recurrence. We don't treat the stone, we treat the patient. So it's crucial to know that 30% of patients will recur. And that means that during our follow-up, that should be done frequently, we need to give not only advice to drink a lot of fluid, not to have a high salt intake, but we need to give specific supplements in order to prevent the stone formation and the increase of the diameter of the stones. So the kidney stone disease, as we say, the KSD abbreviation is of great interest because we have a high annual incidence. So we have new cases and we have a high prevalence. The problem is that we have many innovations regarding operation and treatment, but we don't have many innovations regarding prevention. And as we all know, preventing medicine is the most important topic. So a new concept is to actually interfere in two plans of our stone parameters. One is the composition of the urine. If we have the calcium oxalate stone, which is more frequent, an infectious stone like the struvite, or a uric acid stone. So this is one parameter. And the other parameter is that we have the pH of the urine. So we can interfere also in the pH of the urine. So if we think in these two different directions and we combine them, we may have products that can actually help prevent recurrence and actually treat some types of stones. And this has come out of basic science and out of many years of studies that have demonstrated that we have supersaturated urine regarding the uric acid stones when the pH is acidic, when it's below 5.5. We have, on the contrary, supersaturated urine regarding the infectious struvite stones when the pH is above 6.2. So in these two types of stone, if we actually interfere in these two different ranges of the pH and we actually turn them around, we can have a good treatment and a good intervention. Regarding the calcium oxalate stone, we always have a supersaturated urine, so it's something that you cannot change by interfering in the pH. But for uric acid stones and infectious stones, this protective zone 5.5 to 6.2, it's quite important. And why is this important for the calcium oxalate stones? Because many times we may have the inner part of the stone, the nucleus of the stone, being of a part of uric acid, of a part of struvite. And we know that stones are heterogenic. So we may have a mixture of composition. And if this begins with uric acid or struvite components, then we're going to have a good way to interfere. So this is the whole concept to have intervention in modulating the urine pH, so modulating supersaturation, and also modulating the known theory of crystal nucleation, growth aggregation, by actually adding crystal inhibitors. So by these two different directions, we can actually interfere into the stone formation. So Devicare, which is a Spanish company, and we have the pleasure and the honor to have the CEO talking after my lecture and Professor Gallant's lecture, has actually produced many years now in Spain and has circulated in 15 countries all around the world, 3 different products that actually follow these two directions of intervention. And for the non-calcious stone, which are the easiest stones to treat, but not all of us treat them, we have the lead control pH up. So we are alkalizing the urine and giving inhibitors. pH down for acidification of the infectious stones. So this is roughly 20% of the stone patients that we treat. And also the lead control pH balance for the majority of the calcium stones. So we have 3 products in these 2 directions. As I told you before, we are modulating the pH, and it's crucial to be able to monitor the pH exactly. And this company actually has produced the lead control pH meter. It's patented, and it gives you the opportunity to measure quickly at home the pH as in the lab. So it's very important to have the device with you. And you'll see also by the CEO of the company the presentation of an application. So it's good to have more and more products. For the pH balance, the lead control, as I told you, it's a product that inhibits calcium-based stones without changing the urine pH, because in this type of stone, by changing the urine pH, you won't have the result that you have with other types of stones. And as inhibitors, we have phytate, and also we have, So we have the phytate, which is known many years now, decades, that it's a very well-known inhibitor of a calcium-based stone formation, and magnesium, which we all know it's a very known inhibitor. So the combination of these 2 inhibitors is recommended daily, 2 capsules, and it's given for prevention of this very common type of stones. And there are impressive studies that actually have demonstrated that the dose of phytate, as you can see here, 120 per day, is equally to this huge dose of citrates, because we're used only to citrates as a basic knowledge regarding preventive intervention for stone formers. And as you can see, with phytate, you need 55 times less dosage in comparison with citrate. And you can see how less how less are the crystals with the combination of magnesium and phytate in comparison with these big crystals without the presence of inhibitors. For the uric acid stones, and as I said before, we have the lead control pH up. Again, a good dosology and compliance regarding other alkalizers of the market. Here we have the potassium magnesium citrate, which is we all know it's a good alkalizer. But in addition, we have also theobromine, which again from many studies has proven as a very effective inhibitor. And again, the doses for prevention is chronic. 3 to 6 months are enough for dissolution, and we can increase the doses from 2 to 4 capsules for dissolution also. So these are things that have been clinically proven. And again, quite amazing images where we can see the addition of theobromide, how less crystals we've got. And again, the graphics. And the last is the acidification with the pH down for struvate stones. They are very dangerous stones. We all know that infectious stones can lead up to urosepsis. So it's quite crucial to prevent them and interfere with stone formation. So in this case, we have L-methionine, which we all know from the guidelines. And phytate has been proven in studies that it's a very strong inhibitor of the stone formation. And this is from basic science, and it has to do with the ions and other details that I don't want to tire you with. Again, chronic for prevention, 2 capsules per day. And from our clinical practice, patients are compliant with these schemes because they want something that will protect them. So methionine is well known, but we are not very familiar with the doses in other products. With this product, we are quite happy. And we are quite happy even because we have many studies with these products. We have over 40 clinical trials and 20 case reports. And we need evidence to prove the efficacy of these products. And this is necessary not only for arguing the pros and cons, but also to persuade urologists and persuade our patients to actually take this over-the-counter products. So to summarize, these 3 products are quite precise in interfering with the 3 different stone types. By combining modulation of the pH and by addition of specific inhibitors that have been proven in studies that will interfere with stone formation. Again, the pH balance with the phytate, lead control up with theobromide, and the lead control down with methionine and phytate. And there are case studies that you can find in Devicare's website, and impressive images like this X-ray from a distal RTA case where you can see at the left side the amazing results. So an international distribution of the collaboration of Devicare, all range of products for all different stone formers. So I'd like to thank you for your kind attention and take the opportunity to have Professor Cox input regarding this concept, please.